What is the heart-brain-liver axis?
So the heart-brain-liver axis, but usually we turn it the other way around, it's liver-heart-brain axis, refers to the fact that in liver disease you have an impact also on the cardiovascular system and on the brain, but also the other way around. So the arrows go in multi directions. So what we know is that when the liver is chronically ill, the liver will release a lot of substances that have an impact outside the organ. There's, of course, the consequences of the chronic liver disease restricted to the liver, but there are also multiple consequences possible outside the liver. There can be different mechanisms, multiple mechanisms, but one of the most important mechanisms is that the chronically diseased liver, chronically inflamed liver, will release a lot of substances into the bloodstream and they will circulate and they will have an impact on other organs, most notably on the heart and on the brain. What we know from the liver heart axis is more substantial than what we know, especially in metabolic dysfunction associated steatotic liver disease, on the link between the liver and the brain, or then also, of course, there's a link between the heart and the brain also directly. We know the impact of chronic liver disease when it's very advanced on the brain. That is something that we well know. We call it hepatic encephalopathy, and it's related to substances like ammonia, but also others that are not filtered by the liver, or some of them produced by the liver, and that have an impact on the functioning of the brain, and in the long run may also induce structural lesions of the brain. That is something that we know quite well. But what we don't know very well is the impact that less severe stages of liver disease, and specifically metabolic dysfunction associated steatotic liver disease in earlier disease stages, might have on the liver. And also here there is the hypothesis and also some emerging data that several substances released by the liver, or normally that should be metabolized by the liver, but are not perfectly well metabolized by the liver, continue to circulate and have an impact on the brain when they pass the barrier between the blood and the tissue of the brain. So that impact is there. But as I said, for the connection between the liver and the heart, that is something that we have more data on, so we understand that a little bit better. We know that the liver contributes to the development of what is called atherosclerosis, so uh, structural lesions of the walls of the blood vessels that can lead to myocardial infarction, that can also lead to a brain infarction, for example. So the link between lesions, structural lesions of the arteries and the chronic liver disease, that is something that is well known.
How does understanding the interaction between the three organs impact clinical decision-making and outcomes?
What we also know, although we understand the mechanisms of that not as well as for the link with atherosclerosis, is that there's an impact on the function of the heart muscle. So cardiac insufficiency is also a consequence of metabolic dysfunction associated steatotic liver disease. And also arrhythmias of the heart can be linked to the presence of liver disease in this case. Now, what people often say is that this is not a direct link from the liver to the cardiovascular system or from the liver to the brain. Some argue that it's just the common risk factors that both can lead to liver disease and to cardiovascular disease or to brain disease, that explains the link between the two. Now, I think the data are now clear that this is really too simplistic and that there is indeed a direct link from the liver to the cardiovascular system and to the brain. This also explains why some of the patients with liver disease, they experience fatigue, they experience depression, they experience other psychiatric problems that are clearly linked to the liver disease and not explained by common risk factors, but is something where the liver plays a causal role in. And that is, of course, important. when we think of tackling, managing people living with this disease, that we should take into account not just we then as liver physicians, the liver part, but that we should first of all be conscious about the impact the liver disease has on other organs, and that in the management of this problem, we approach it from a holistic point of view and not just look at the liver problem in isolation, but that we keep in mind that the liver has also consequences on other organs.
What risk factors are shared among the diseases that affect the heart-brain-liver axis?
So non-communicable diseases, or NCDs as they are known, occur between the ages of 30 and 70 and are caused by cardiovascular disease, cancer, chronic respiratory diseases and diabetes.
How does obesity contribute to the development of metabolic-associated steatotic liver disease, and what role does this condition play in increasing the risk of liver cancer?
Obesity underpins all four of these diseases and also results in fat accumulation in the liver, known as steatotic liver disease. Steatotic liver disease affects over 1/3 of the global adult population and is a silent contributor to the NCD epidemic. In children, it has a prevalence ranging from 7 to 9%, reaching approximately 40% in obese children. Metabolic dysfunction-associated steatotic liver disease, or MASLD as it is known for short, is the most common cause of liver disease and forms part of the metabolic syndrome, which encompasses obesity, insulin resistance and diabetes, high blood pressure, high blood cholesterol and fats, heart disease and stroke. Studies suggest that MASLD is associated with compromised brain health and cognitive dysfunction, initiating a growing interest in exploring the liver-brain axis mechanistically within MASLD pathophysiology. With the prevalence of MASLD increasing at an alarming rate, leaving a large proportion of people potentially at risk, cognitive dysfunction in MASLD is a health challenge that requires careful consideration and awareness. Modelling from human biobank studies has demonstrated a heart-brain-liver axis linked by common pathways with evidence of both direct and indirect associations. Many chronic illnesses such as ischemic heart disease, stroke, neurocognitive decline or dementia, and fatty liver disease tend to co-occur, and these conditions are critically influenced by a set of shared risk factors, including elevated body mass, high blood pressure, and diabetes mellitus. Furthermore, patients with MASLD are at an increased risk of developing neurodegenerative conditions such as Alzheimer's disease. Like MASLD, Alzheimer's disease is a major global health problem, expected to affect 81 million people worldwide by 2040, without any effective treatment or cure. Remarkably, MASLD shares common features and risk factors with Alzheimer's disease, suggesting disturbances in the liver-brain axis which may explain their development. Most likely, lifestyle factors including poor diet, physical inactivity, excessive alcohol consumption and smoking are likely to play a major role. Chronic inflammatory conditions linked to organ fat and cytokine release can also negatively affect cardiovascular health, brain function, and liver metabolism. Obesity, alcohol consumption, and tobacco all increase cancer risk. Chronic inflammation from MASLD increases the likelihood of developing liver cancer, known as hepatocellular carcinoma, even in livers that do not have evidence of advanced liver disease known as cirrhosis. This makes obesity a critical factor in liver cancer development. Insulin resistance and diabetes further elevate liver cancer risk.
What are some of the policy goals that health advocates should be working towards in addressing non-communicable diseases associated with the three organs?
First and foremost, we need to integrate SLD in the WHO NCD portfolio, where it remains to be officially recognised and where it must belong. Like obesity, steatotic liver disease is preventable, and a healthy liver leads to a healthy life. To do this, we must promote healthy diets and increased physical activity. This involves supporting policies that reduce sugar-sweetened beverages and processed foods. We need to increase community access to affordable healthy foods and exercise facilities. Food is medicine. We also need to raise awareness about the importance of early detection and lifestyle changes that reduce risk factors associated with cardiovascular disease, degenerative brain disease, and liver disease. This can be done through integrated health screening by advocating for routine metabolic health checks that assess cardiovascular, brain, and liver health, enabling early intervention. We must address social determinants of health by promoting strategies to reduce health disparities by improving access to healthcare and preventative services in underserved communities. Finally, we must encourage taxation and regulation on unhealthy products such as sugary drinks and ultra-processed foods. There needs to be stricter regulation on the marketing of unhealthy foods, especially to children.